Oh, my aching back. Well, chances are pretty good you've said that before. I've sure said it. Hi everyone, I'm Dawley Mercer-Plank. Back pain is one of the most common medical complaints in adulthood. The specialists at Lexington Brain and Spine Institute tell me that 90% of people will have a doctor's visit at least once in their life for back pain. That is why it is so important to understand the comprehensive care available at this Lexington health practice. Dr. Troy Dawley is a neurosurgeon at Lexington Brain and Spine Institute. He and the other clinicians here see the full spectrum of back-related issues.
So talk about the different types of back pain.
Yeah, so there's many different types of back pain. They usually range from musculoskeletal injuries to degenerative problems. Those are by far the most common, but rarely we do have problems that can be coming from other issues such as tumors or patients that have had significant trauma.
The title of the practice, the Lexington Brain and Spine Institute.
Right.
Where is back in all of that?
Yeah, the back is a portion of the spine, and many times patients will say, well, my back hurts, and that can be your neck or your mid-back or your low back, and all of those things are related, and we treat all of them here.
So talk about that care. It's considered comprehensive care, literally under one roof.
Right. That's the benefit that we have here really is right next door to neurosurgery, we have pain management and physiatry, and just below us, we have physical therapy, and all of us communicate regularly.
Those four specialties at Lexington Brain and Spine Institute, neurosurgery, pain management, physiatry, and physical therapy, complement and support one another.
All of them have a little bit of overlap of care. Neurosurgery really specializes on surgical disorders, but we still need to see a lot of patients. A majority of them that we see end up not needing surgery. And so that's where the other parts of the practice really complement, because physiatry and physical therapy work in non-invasive measures to treat patients. And then with physiatry and pain management, there's more invasive ways to treat pain and things with not surgical options such as injections or what have you.
Dr. Dawley will often refer patients to Dr. Zachary Ashmore on the pain management side of the practice, creating seamless teamwork. Dr. Ashmore treats patients with minimally invasive procedures who may not need surgery but are not getting enough relief from conservative measures like physical therapy alone.
One of the things that we're able to offer is targeted image-guided procedures, such as injections. So those could be joint injections, they could be peripheral nerve injections. We also offer radiofrequency ablation, which can provide longer lasting relief for spine-related arthritis.
Oftentimes, the pain a person feels elsewhere in their body stems from a problem in the spine.
And one of the common causes of pain radiating down to the leg could be irritation from one of the nerves in the back or compression on the nerve as it travels down or exits out of the spine. Other components of the spine can refer pain down to the leg as well. So joints, for instance, can refer pain to the thigh. You can also have SI joint pain, which is where the very bottom portion of the back interacts with the hip and forms the SI joint. And that can cause pain going down the back of the thigh.
So when you do like an injection, is that specifically for nerve pain only, or is it for muscular pain as well?
Pain can come from multiple different generators, and the target for the injection really depends on what the suspected main generator of the pain is. Those could be musculoskeletal in nature, or they could be more related to nerve root impingement or irritation. If a patient has more arthritis-related pain, then we may do a steroid injection targeting the joints that are suspected to be involved.
At what point back pain means you have to come to the doctor? Because sometimes it seems like you take a couple Advil
Sure.
and you're okay.
Sure. Yeah, when the pain really is persistent after doing something like that, anti-inflammatory, rest, heat or ice, if after a few days of that things are not getting better, or certainly if they're getting worse, that's a sign that maybe you should call your doctor or come and see us.
So what are the symptoms somebody should watch for to know it's time to come in?
So worsening pain that is debilitating, where you can't get up and walk and do your normal activities, and also radiating pain down your arm or down your leg that feels like nerve type pain. That's a sign that something's not right and you should be evaluated.
Once the patient arrives for an appointment, the process of care is flexible depending on the patient's needs.
We really try to evaluate the chart quickly and get patients to who best would be seen for them based off what we know. However, we all work up new patients, and if they see me and they do not need surgery, then I can get them to physiatry, physical therapy, or pain management. You know, I have times where another physician will come to me or vice versa just to say, hey, can you look at this? I think this patient should really see you instead of me. Can we get him or her in to see you in the next couple days? And that's not a problem. We do that all the time.
Many people assume that visiting a spine institute means they could be headed straight for the operating room, but most patients do not end up needing surgery.
Majority of patients we see don't need surgery. And many of the patients we see, we follow and monitor in case things get worse. Then obviously we have that option, or we change course to perhaps from physiatry or physical therapy, we need to try pain management. But a significant majority of our patients end up not needing surgery. A lot of times these pain issues with our back and neck that we deal with as we age can be treated conservatively.
It is important to note that no referral is needed for most insurance carriers. Patients can call directly and often be seen without going through a primary care provider first. Patients who come to Lexington Brain and Spine Institute range in age from early 20s to late 90s. But before walking through the practice doors, there are simple habits that can help protect the spine.
Taking a gradual return to activity can be a helpful principle. We often find that lifestyle factors can play a significant difference or impact in someone's incidence of low back pain.
Like what?
So that includes things like adequate sleep, avoiding smoking, healthy diet, focusing on maintaining an ideal body weight. All of these factors can make a meaningful difference in terms of someone's own incidence of low back pain.
Walking is by far one of the best exercises we can do. And then really eating a good healthy diet and staying hydrated. Really stretching routinely is very helpful before getting out and doing yard work or exercising.
On a personal note, how satisfying is it for you when somebody walks in holding their back or walking slowly, and then later they're like, oh, I feel great again?
So we love to see the joy on people's faces whenever they've had a successful treatment plan. We love hearing those personal stories and anecdotes of, I've been able to play with my grandkids again, and I've been able to pick them up, or I've been able to go to the supermarket without my back hurting. Those are the reasons why we love to treat the patients that we do.
It's no wonder U.S. News & World Report named Lexington Health as the best hospital in the Columbia metro area for the 4th consecutive year. To learn more about the leading treatments for back pain and for other disorders of the nervous system and brain, please visit lexingtonbrainandspine.com. And be sure to click the like button and subscribe to our channel so you can get notified of future stories in the HealthCast series.